I have pain, and will I miscarry? So there can be a lot of pain throughout pregnancy. There are a lot of aches and pains. And especially in today's day and age where we can just pop a painkiller or eat some food or go on social media to seek comfort, shopping, all of that, we have instant solutions. But pregnancy related pain can be something which can last for a really long time. Now, if you have been pregnant before, for sure, you probably know it already, but this is specifically for patients or women who have been pregnant for the first time, or who have had multiple losses, or who still need that sort of reassurance when they are scared. So know this, that throughout pregnancy, pain can mean differently in different trimesters. So if you are pregnant for the first time or whenever, and you have pain in your first trimester, as in you just got to know that you're pregnant and you constantly feel this period kind of pain, what should you do? Well, it can mean many things, right? Generally, first of all, if you start having a lot of pain, I'm talking about not period like pain, but just like a discomfort, that's normal. Okay? If you are anxious at that point and you want to know if everything is okay, because even when everything is okay, our brain can make it mean that something is wrong. So at that point, you can always go to your doctor and get it checked if the pregnancy is in the uterus. If the pregnancy is not in the uterus, then you will need some follow-up tests, and sometimes you just need some time and patience, not anxiety, patience to wait and manage your mind in those days until we find the pregnancy in the uterus. Now, when we find the pregnancy sac in the uterus and it has a cardiac activity, that pain doesn't mean much. But if we didn't find a pregnancy sac in the uterus, or this baby has been there but the cardiac activity or the fetal heart has not come for weeks, that's when it's a problem. Because then it can mean it's a failing pregnancy, or it can mean as an ectopic pregnancy. And both these things are not that uncommon. So when you have any sort of pain in pregnancy and you have not done an ultrasound, go get it checked. Go to your doctor and be ready to know whatever the doctor tells you is, he or she might not be able to give you an answer right then and there. Because sometimes things don't just show up. Sometimes we don't find a pregnancy in the uterus. And that can mean waiting for 2 more days to find a pregnancy. Sometimes we find the pregnancy hormone in your blood. But that can mean the pregnancy sac is still not on the ultrasound, and that's fine too. In all such occasions where we don't know where the pregnancy is or if the pregnancy is healthy, we need to practice patience. Don't be in a hurry. Don't start thinking that this is a bad baby, let's get rid of it, or there's something wrong, do some surgery to make it okay, take a lot of medications to make it okay. Don't do. First trimester is all or none. And this pain sometimes can mean everything is still fine. It is sometimes just the uterus which is heavy and it feels painful. And you might find that the baby is fine and the cardiac activity is there. That is all fine. Right? So this is all about first trimester pain, and the chances of you miscarrying, only time can tell. There is a 15 to 20% chance that the miscarriage can happen, but whether that's you, we don't know. Right? So the only thing that you need to practice this time is patience and belief that maybe this baby is okay.